The information we're looking at today deals with drug testing, which is something that a lot of you and maybe all of you are going to have to do in your internships or your jobs. If you work in a treatment center or in a hospital, this is something that's a very common part of treatment. It's good to understand the purpose of why we do drug testing, some of the best practices, as well as knowing what the drug detection windows are, meaning how long can we test for a certain drug. So the information here should be helpful to you as you move forward, and there will be audio as well as information on each slide. So let's talk briefly about why we even do drug testing. And it's done, of course, at a lot of jobs now. It's very common, and of course in treatment as well. We sometimes use it to try to prevent somebody from using as kind of an encouragement to stay clean, knowing that they're going to be drug tested. So it may be a way to support somebody's recovery. It also gives us information if somebody's new in the treatment program about if they've recently used and what type of drugs are in their system to begin with. If a client is in treatment already, whether it's on an outpatient basis or on a residential basis, it gives us an idea if the client has stayed clean or is continuing to stay sober. So it gives us some kind of objective feedback that way. It can also be used, especially in hospitals or by doctors, to tell if somebody is taking a prescribed medication. So if you have a client who is supposed to be taking a drug like methadone or Suboxone, possibly for medication-assisted treatment, you want to make sure that that's actually in their system. We can also test for several different types of mental health medications, and that could be beneficial information as well. And then, as I mentioned, a lot of jobs do it, so it's part of employment decisions. So those are some of the most common reasons that we even do drug testing. So there are several different types of testing available to us. The one that people are most familiar with and is the most commonly used in treatment is urine testing. And that one's obviously fairly easy to do on site. There are programs that may do blood testing. You would typically only see that in a hospital kind of setting, and that would be done by medical personnel. So for most treatment programs, you wouldn't be involved in that kind of testing. Saliva testing is becoming more common, including by police officers. There's some different field tests right now that can test for certain drugs in saliva. And they're looking at developing particularly tests for marijuana use that saliva would detect. So those are getting to be fairly accurate and more common, although the window of detection is a little bit lower. It's only about 24 hours. Labs can do hair testing, and hair testing is actually quite useful in some cases. It can be done for a long period of time. It can test back a long period of time. So 1 centimeter length of hair is about 1 month period of time. So if you had even 2 or 3 inches of hair that could be tested, you'd be looking at several months that could be looked at. It is more expensive than other types of testing, and I think for that reason isn't as common, but it is a useful tool. We now also have sweat patches, or what's called a scram monitor, which is a bracelet you can wear around your ankle and actually measures the amount of alcohol being released from your body through sweat. And then, of course, we do breath testing. That's the common thing you'll see for alcohol testing on if somebody's pulled over, like for DUI on roadside tests. That's typically what police will use, is a breath test. And a lot of treatment programs may use a breathalyzer as well. Before we look at actual drug detection windows and how long we can measure whether somebody's used a drug or not since their last use, it's important to understand a few other factors, including obviously how long it's been since their last use. So certain drugs leave the system fairly quickly, and so we may not be able to catch them on a test because of how long it's been. You also have to think about the frequency, so how often somebody uses, and the quantity, so how much they use. So the more frequent or more often someone uses and the greater quantities they use, the longer it's going to be in their system, the more likely it is that we're going to be able to detect that with a test. Everybody's metabolism, of course, is going to be different, and so even though we have general windows, one person's metabolism may be faster or slower than average, and that may affect drug detection. If a person has any medical conditions, particularly if they're related to liver functioning, that can certainly change their ability to metabolize drugs and how long we'll be able to detect a drug for. And then also important is the type of test that we're using. So we looked on the last slide as far as different ways that we can test for substances. And then even if you're doing something like a typical urine test, there are tests with different levels of sensitivity. So you have to So this chart here provides some fairly useful information as far as the most commonly used drugs and the most common drugs that we test for, and then a pretty average window of detection time using urine testing, which is the most common that we see in treatment centers. So that's primarily what we're looking at here. So benzodiazepines, these can actually have a wider range because there's some that are slower acting and some that are faster acting. The more typical benzos we see are Valium, Xanax, and Ativan. And again, there is a range there. Typically, you're looking at least 3 to 4 days, possibly up to 7 days for slower acting benzos. Methadone, which is an opioid drug, can usually be detected for about 2 to 3 days after last use. Amphetamines, different stimulants, and methamphetamines as well are also for up to about 3 days. And you'll see that that's a pretty common window, 2 to 3, maybe on the long side, 4 days for most drugs of abuse. Moving down to THC, which is the active chemical we find in marijuana. For just one single use, you're probably still only going to be able to detect that a few days after the person is used, maybe as little as 1 or 2 days, but no more than 3 or 4 days. However, a regular chronic user can most likely be found in a drug test for 2, 3, possibly even 4 weeks after their last use if they're heavy and regular users. And the biggest reason for that, of course, is that THC is fat soluble, so it's stored in fat cells. All these other drugs are water soluble, and so our body excretes them fairly quickly. But THC, especially in larger quantities, is going to stay around longer. You can keep going down that list: cocaine, opiates, which is going to be anything in the heroin, morphine family. Those are going to be about 2 to 3 days. Ecstasy, maybe a day longer. And then alcohol, for most of our common testing with that, which is breath testing, you're only going to find that for 12 to 24 hours after last use. We'll see on another slide about how long it takes to metabolize alcohol, but typically you're not going to catch that several days after the fact. So we're mostly looking at somebody who's drank the night before or maybe the day of and being able to catch them that way. So after seeing those drug detection windows, here's some issues to be aware of. Generally speaking, most drugs are only going to be detected by a urine test for a few days after use, and possibly as little as 1 or 2 days, again, depending how often somebody's used and how much they've used. So don't be shocked if somebody even admits to you that they've used, or you feel very sure that they did use within the last couple of days, but the test isn't showing that it's positive. The one exception, of course, is marijuana. Being fat soluble tends to stick around much longer. We talked about alcohol a little bit. So typically our body gets rid of alcohol, our livers metabolize alcohol at roughly a half a drink per hour. So some people think it's closer to 1 drink per hour. It's actually less than that. So if you were to have 5 drinks, it would take you probably 8 to 10 hours to completely get rid of that alcohol. And that's why even if somebody drank the night before, if they were tested the following day, you still may be able to detect that with a breathalyzer test. Now, there is a way using urine testing and checking for a metabolite called ETG that you can actually find alcohol use going back about 72 hours. And this is being used a little bit by treatment centers. The only thing to be aware of there is that ETG will come from any source of alcohol. So if it's mouthwash, if it's some kind of food that had alcohol in it, even hand sanitizer, anything like that that gets into your system or that you've been exposed to could show up as ETG and make it look like you've maybe had some alcohol to drink when you haven't. So that's something to be aware of there. Another issue is that we have a difficult time testing for certain drugs, especially synthetic drugs, because there's always something new out there. By the time police and treatment centers know about a certain drug, there's already something else being made out there. So it's difficult to then have a test that can check for everything. Also be aware that a negative test, meaning you don't find any chemicals or drugs in a person's system from that test, that does not mean a person hasn't used drugs. It just means it's not showing up on the test for one reason or another. Also be aware of cutoff levels. Like I said, when you use a test in a treatment center, there are different sensitivities. So one test may find that somebody's positive for a certain drug, let's say for THC, if it uses a certain cutoff level. And another test, which is also looking at THC, may show up negative because it's set at a higher cutoff. So of course, the lower cutoff level is going to be more sensitive and it's going to get more positive results. A higher cutoff level is going to get more negative results and find fewer positives. So just a few things to note. So what kind of drugs are we actually going to test for? We have limited resources, both in time and money. So this is something to think about. Laboratories can test for hundreds of different drugs, even thousands of different drugs, but that would be expensive and impractical. So what we try to do is focus in on a few key drugs that we think are most likely to be used and might be the biggest concern for our treatment center. A lot of treatment programs, a lot of them do test right on site. So as an intern or as a clinician or a counselor, you can do the drug test right there on the spot and get a result back within a couple of minutes. And typically those are going to check for just a few of the most commonly abused drugs. You'll often see something called a SAMHSA 5 panel, and that was developed in the 1980s. It's still very commonly used in treatment centers. It contains, as it says, 5 different drugs that it's testing for. So THC, which would be marijuana, cocaine, opiates. It's only going to catch, in this case, drugs like morphine, heroin, or codeine. It will not catch newer opioid synthetics like fentanyl or Vicodin, so be aware of that. Amphetamines, and then PCP, and that one is sometimes surprising to people that we test for PCP. The reason is that when the panel was developed back in the 1980s, that was the one of the 5 most common drugs that they were finding, and this was based around federal testing guidelines, and they were particularly looking at transportation workers like truck drivers. So anybody who is a federal employee still has to use the SAMHSA 5 panel, and even though today PCP is probably not in the top 5 abused drugs that our clients are looking at, that's still a typical panel that you might see. Now, there are different drug testing companies. There are individual panels that only test for one drug, and there are some now that will customize for your treatment center what grouping of drugs you want. And I've seen some that do as many as 10 drugs on one panel, so you can test for quite a few different things. Now, the capabilities are pretty good. Here you have 2 examples of different drug tests that you might see. So the one on the right is pretty similar to the SAMHSA 5 panel that I just mentioned on the last slide. Although if you look really closely, you can see on that very bottom one, that's in the lower right there, it says BZO. So that's actually testing for benzodiazepines, probably a much more practical and useful test than for PCP these days. That one also tests for cocaine, other amphetamines, THC, and opiates. So that's the 5 panels, so you can see the different strips that would be sticking out. You would actually pop the cap off of that, you dip that test for maybe a minute, and then you're going to start to see lines form there in the middle. And then there's a way to read that, whether the test is negative, meaning it did not detect a drug, whether it's positive, and if there's no lines at all, it would actually be an invalid test. So along that C line, which would be for the control, you should see a solid red line in each of those areas. The place where it says T, that's the test itself. So that's whether it's testing for the drug, whether it's present or not. So if you do see a line, that's a good thing. If you don't see a line, that means that it is positive for that test. It's reactive, in other words. So it's checking for a particular metabolite in the urine. It reacts, so it doesn't produce the line, and so the test is positive. On the left-hand side, you have probably a slightly more expensive test, but it's one that might be a little bit easier to use. The client can just urinate right into that cup, put the top on, and then you're going to see the test results show up on there. And so you can see that one's very similar as far as how you would detect it. Either of these tests are going to cost no more than a few dollars each. The typical 5-panel test is between $1 or $2 when you buy them in quantities. The cup test might cost more, but not more than $5. Although, again, if you start thinking about potentially dozens or hundreds of clients, that cost does add up and is something to think about. Let's briefly discuss some potential concerns that might come up with drug testing. So for one thing, you could get a false negative, and this means that the client does in fact have drugs in their system, has used, but is not showing up on the test, either because the cutoff level is just higher than what's showing up. Maybe they've masked the test in some way, or they've cheated the system somehow, which does happen. And we'll talk more about some of those in a little bit. You could potentially get false positives. These are a little bit less common, but a false positive is where the test shows that the person is positive for a certain substance, but they didn't in fact use. Now, if this happens, it's important to look at a lot of different factors. What's actually showing up as positive? Is that a drug that the client has used in the past or is getting treated for? Is the client taking any medications? Do you have anybody who's been around the client, like friends or family, who might be able to speak to anything that's been going on with them? And also observing what their behavior's been like recently. Are there any signs that anything else might be going on? And of course, important to have an actual conversation with the client before we jump to any big conclusions. One of the reasons that clients often deny using or are even afraid to drug test is because we take that positive test, if it is positive, and then it's used in some way to punish the client. And that could be through probation, through the courts in some way, or even the treatment center, perhaps saying the client can't participate in treatment anymore, or some other kind of punishment. So we want to be aware of what the purpose of the testing is, and then what are we going to do once that test comes back. And another thing is the cost of testing. So these certainly aren't happening for free. So is the client going to be paying for testing? Typically insurance is not going to pay for that. So the treatment center may have to include it in their budget in some way. And so how often is it reasonable to test, and different types of testing that you have available? So just consider some of those issues. All right, now it starts to get a little interesting. Like I said, clients do try to cheat the system sometimes, especially if they have used a drug and are worried about being positive. So there's several different things out there. There are what we call prosthetic devices, and there's a popular brand called Wizinator. And if you want to look that up online, you can. It's essentially a belt that you would wear around your waist, but it would actually be bringing urine in with you, which could be another person's or could be yours from a time when you hadn't used and you were clean and you've stored in some way. So that can happen. Substituting, meaning that you actually have someone else's urine and you somehow swap it out. Maybe you have it in a cup or something like that, and you make it seem like it's yours. Putting in some kind of adulterant. I've heard of clients trying to use bleach, put little powdered bleach under their fingernails before they go in to do a drug test. And there's other adulterants that could be dropped into the sample that could affect the test. Dilution is a very common one, and so that essentially involves drinking a whole lot of water and trying to flush your system right before you do a drug test. And so essentially what would be collected at the drug test would be mostly water, and to a point where you couldn't detect any of the drugs that are in their system. And you'll also see on the market, they sell all kinds of detox drinks or kits. Some of them are better than others, and you can read different blogs online and find out what people are using and what's available out there. Most of them will have you still drink a lot of water with them, but there's two that I have either heard of or read about, and one is called Test Clear, the other is called Pass Your Test. And these seem to have gotten pretty good feedback from clients as far as actually being able to take it and pass their test, even though they probably should have been positive, meaning they had used recently. But whatever it was in these different tests did help them pass and have essentially a false negative test. So just know that there are a lot of different things that clients can try, and you probably will deal with some of these at some point. There are a few different things we can do to help prevent or stop cheating the drug test so that we get an accurate result. Probably the most obvious way would be direct observation, so seeing the client actually taking the urine test. And I know that makes clients very uncomfortable and sometimes counselors very uncomfortable, but that typically is what the agency's policy will be, so that you'd be right there with the client, and you can observe if they're trying to do anything inappropriate. You can also have the client empty their pockets, before they go into the bathroom. Make sure they don't have anything on them. They're not bringing anything in there with them. If they've got, a large sweatshirt or coat, that can be left outside, which again, if they're trying to bring something in with them, that may help prevent that. Also, there are a few different things that we can check for in the urine to make sure that it is legitimate. So we are looking for a temperature that's pretty close to body temperature. Even for several minutes after they've done the test, the temperature should still be in the 90 95 plus degree range, pretty close to body temperature. Something that would be done at the lab most likely would be to check creatinine level, which should be greater than 20. And if a client has had a whole lot of water to drink, a lot of times that will drop down real low. Another thing they can test for is the pH to make sure it's in a normal range. And then one thing you can do visually is look at the color. If it's essentially the color of water, that would be a suggestion that either it is water or they've been drinking so much water that they've diluted it and you're not going to get a good test. So in those cases, something you could do is tell the client you need to retest or that you weren't able to get an accurate result, or ask the client if they did, in fact, in some way try to cheat the test or dilute their sample or something like that. So finally, to wrap up, here are some best practices to use for testing when you're doing it in treatment. And it's important that we do random testing so that it's unpredictable to the client. So if you've had a test one day, you don't know for sure whether you're going to be tested the next day or in a week or in 2 weeks, exactly when that's going to fall. Early in the testing program and in a recovery program, generally recommend more frequent testing, and then that can be decreased a little bit over time. When possible, if it's affordable and you use a lab and the treatment center is able to, confirm a positive result by sending it to the lab. Or if you aren't sure or you don't have a lab you can send it to, you could always do a second panel test right there on site. Just make sure that that's part of the agency policy and that is being followed. ASAM does recommend that we lab test both some positive and some negative results. So even if we don't send every single result to a lab, it would still be a good idea, they think, once in a while to go ahead and send a positive test off to the lab just to see, make sure that we're getting that accurate, as well as some negative tests, because there are things they could do in the lab that may be able to detect greater sensitivity. So find out if there's a drug that is there in their system, or if there's some other kind of adulterant or something that's been done to try to cheat that test. Also very important, and this is the real clinical piece and the counselor piece, is to have conversations with clients before we ever drug test them so that they understand the policies, they're not surprised by testing, they understand the purpose of drug testing. And then also, if a person does have a positive test result, that we don't just hold that over their heads or threaten to punish them with that, that we actually talk about what's going on with them and see if we can have some kind of dialogue around what led to their drug use and what kind of positive steps we can take from there.